Hello, this is Dr. Williams, and this lecture will cover healthcare policy for advocacy in healthcare. Please utilize this brief introduction to healthcare policy and advocacy in healthcare, along with your reading assignments and the articles that was given to you to enhance your understanding and intrigue you to understand the importance of advocacy and policy influence of advanced practice. In this lecture, some of the objectives that we will cover is one, to analyze the federal and state healthcare policies and explain their impact on nurse practitioner scope of practice, reimbursement, patient access, incorporating guidance from the American Association of Nurse Practitioners and the National League of Nursing. We will critically evaluate policy and position statements from the American Association of Nurse Practitioners, the National League of Nursing, and other regulatory agencies, and how they influence the nurse practitioner education, certification, and practice authority. We will compare the advocacy roles of professional nursing organizations in shaping legislative priorities, workforce development, and competency expectations for nurse practitioners. And then we will apply that health policy knowledge to practice by assessing how organizational policy positions affect clinical decision making, quality care, health equity, and interprofessional collaboration. Let's get started. Clinicians. I like to start with a video that highlights how a bill becomes a law. As you're watching this video, this is a video from Schoolhouse Rock that was created years ago. But what this video, I hope you glean from the content, is that when a bill is introduced and becomes law, it is not a simple process. And so as you hear the information, consider what can happen with bills once they're introduced, what it means when it says a bill has died on the floor, and what could be some of the contributing factors for that. And you as an advanced clinician, how could you mitigate some of the challenges that confront bills and prevent them from becoming a law? Great. So now let's move on and let's talk about what does it mean related to health policy and advocacy for the advanced practice clinician. So when we think about laws and bills, I want you to think about these things are what helps to address our scope of practice, giving us our restrictions, as well as giving us our ability to have full scope of practice. There are some challenges that do exist related to things like reimbursement. And then we know that there are barriers that do need to be removed so that we can actually advocate um, for those things that will impact us. And advocacy, we know, is a big part of getting bills from to be passed as law. So we have individuals like lobbyists who go to the Hill and they speak on our behalf. They go with the United Voice. They go understanding the facts, the information, and how, and then they then share that with our congressmen, our senators, the legislators. So how do we begin to understand the complexity that surrounds policymaking? There are many individuals and researchers who have looked into this. The first one I want you to think about is a researcher, Dr. Ham. And what he talks about is that reviewing policies includes the need to formally study how decisions and actions are made. And that policy must include the network of interacting decisions. And it takes time to have policies to come into play, from bills to go from a bill to legislation, but even to just to have the change, because just because a bill is enacted into legislation, it can take time for the law to actually disseminate down through. And then he also talks about how policies are not acted on and that we need to make sure that we're constantly reviewing these policies. So not only for in legislation, but within our professional organizations and our places of employment and in places like even education, right? And then understanding that we must be able to identify what policies are created and how do we make a decision on which policies we want to consider. Which bills do we want to go before legislation? Because there are many different things that we would like to address, but how do we choose which one we want to address? So let's talk a little bit about the relationship between nursing and policymaking. It began as early as Florence Nightingale. So I want you to think about when she developed the processes and the policies that we now look at when it comes to sanitation and infection control. And then I want you to think like in the 1900s, we had individuals like Walden Dock. And what they did was create policies that was reflective of women's rights, nurse and licensure, right to health care, and then we can see that we can kind of follow through to the 1970s and the 90s where we started to do things like creating the paradigm for advanced practice nursing. Because remember, if you think about your concepts and theory course that you took in your first semester, when we think about the paradigm for advanced practice nursing, it was developed from nurse practitioners or midwives meeting the needs of the community and practicing where there was concern and people didn't understand what a midwife could or could not do. So the development of the paradigm for advanced practice, along with some laws that help to develop the scope of practice, help to limit things like litigation against advanced practice. If it was a midwife, if it was a family nurse practitioner, CRNA, certified nurse anesthetist. So that transition happened, and it all started with Florence Nightingale. And then in the 70s and 90s, we talked about the paradigm. Then we started to move a little bit more specific, not just on what we did as advanced practice, but then we looked at how and what was the impact? And with that impact, what legislation did we need to be in place that would help us as advanced practice and our community and our patients? And then if you look at the 21st century now, we're talking about legislation that unfortunately has to deal with some of the conflicts we have with our physician counterparts, right? The prescriptive authority, our scope of practice, the quality of care. So all of that is an evolution from the beginning, which we started out with Florence Nightingale. So now let's talk a little bit about public policy itself, right? It is created by a governmental legislation. It involves both laws and regulations, and these can be divided into social and health policies. And we as advanced practice nurses and clinicians need to have a working knowledge of what legislation and regulation language is like. What does some of the things we read about, some of the things that we that guide how we practice, we should understand what that language is. Now let's transition from not only just the history of legislation, where it has um, how it has progressed over the years and impacted the advanced clinician, and our responsibility to understand the process and the language. So let's specifically talk about the process of legislation, right? From the advanced practice clinician's perspective. We as advanced practice clinicians, we are partners with our legislator. So we need to be sitting at the table and have input into the process in which they are drafting these bills, these policies. We don't want to be just a receiver of those policies, but we want to have input. We want to be able to speak. Who can speak better for us about what our needs are, what our patient needs are, how the healthcare system is impacted or impacts us than us? We are the experts at what advanced practice clinicians can and cannot do, and we need to be sitting at the table and having and helping others to understand that. We should also understand that when we think about legislation, that the more power one has, the increased chances of legislation being passed, right? And when you have supporters of your bill, or that you get those supporters, and then you need those supporters to be able to introduce that to the chambers in Congress. So lobbying is important, calling your representatives, make an appointment to go see them, having a conversation, not only with them, but with their staffers. And then once you do that, that individual, if someone is willing to take your bill and introduce it to the chambers, we then want to try to get bipartisan support. So although we know that certain bills tend to lean to one party or another, you want bipartisan support. It is hard to get a bill to be passed into law without bipartisan support. If you have that support, it can then be referred to committees. It is in that chamber of the committees where they review your bill. They then take both oral and written testimonies about that bill and they mark it up. This is when they start to add their it could be their suggestions about the bill. It also where they may mark out, right, some of the things that you have in that bill. So it's very important, and you can see that this is where the process of a bill becoming a law can take time. So you have to be try to be very strategic, very purposeful at what you have written when you're writing a bill. And remember, in the back of your mind, considering it should be bipartisan. This is also the time in which other bills may be added to a bill. So traditionally, one bill is introduced, and then others during this process, this oral and written testimonies, is when they may say, let us combine bills together. That can be both a strength and a weakness. There are some things that people are interested in bipartisan wise, our representatives, so they wanted to move forward, but that could also be a hindrance, or it can also slow down the process because now you have more things that they have to discuss, and give their testimonies on, and you got to get approval for. But if you can then do that, then that bill can now move to the Senate or the House floor for a vote, right? And then during that process, that's when the chambers will have make their move to have that bill go to a conference committee. And once it goes there, that bill could be moved to the executive branch. So they got to vote on it, right? And then it goes to the executive branch. And if you remember from our video, the Schoolhouse Rock video, this is also where bills can die, because if you don't get that support, it can keep going back and forth and it doesn't move forward. So how do we move from a bill that has now gone through this process, and say you do get it through the House, you get it through the Senate, the executive body agrees on this bill and they don't veto it, right? How do we implement now that bill or that regulation? Because the implementation is a whole nother part, right? And that must occur on both the state and the federal level. We know that there are state laws and there are federal laws, but how do we get that to go through both? That bill is sent to a regulatory agency. I want you to think about advanced practice clinicians. Who is our regulatory body? Who decides our scope of practice? Those are the things you want to think of. Think about the Maryland Board of Nursing for us here in Maryland. And then they then get to take that bill and they get to interpret it, right? Or shall I say that law? They interpret that law and then they now create the rules and the regulations based off of that law. So now you can see how it goes from a proposal of a bill going through the legislative process, it gets approved as law, but then it goes to your regulatory bodies and then they develop the rules and the regulations on how it's going to be implemented. And that is done on all state levels. So the Maryland Board of Nursing may write some rules and regulations that may differ from Delaware. It may differ from Iowa. That is why if you choose to practice in multiple states, understanding what their state rules and regulations are according to the way they interpret the law is important. You are held responsible for that. It is not as if just because you have a scope of practice that you can look at it globally. You have to look at it state by state. So when you think about your regulatory bodies, I want you also to remember they are the ones that help us to make sure that we're staying in our scope of practice. They're the ones that help us to organize, right? To ensure that the way in which we practice as advanced practitioners is appropriate. And then it then trickles down also to our professional organizations. I want you to think of American Academy of Nurse Practitioners. I want you to think of the National League of Nursing. I want you to think of organizations like NOF, the National Organization of Nurse Practitioner Faculty. These are organizations that help to provide us with resources to help us to understand our responsibility in whatever role that you're in. It is also a great place for us to begin to have networking. We can have conversations with other professionals in our discipline that may be locally, nationally, and internationally. And we can hear what is going on in other states. We can see where we align or where we have challenges, but we also can also build up that strength that we talked about, that power that is important to the progress of any bill being translated into law and eventually our regulations and our policies, right? And these organizations that we have, they help to prepare us. So representation, joining your organizations is foundational to the support of our profession as a whole. So I want you not only to think of it as somewhere that you are just putting your money, but it is somewhere where we develop power. Because think about our lobbyists going to the Hill, and they can say they're representing over 3,000, 50,000, 200,000 advanced practice clinicians and nurses. So that strength is in numbers. So what are our lobbyists? Who are they? They are the individuals that go, they have education and policies and law, and then they go to the Hill and they speak to our representatives on all levels on our behalf. One of the things we know as advanced practice clinicians, as nurses, we do have a voice at the table, but we also have our counterparts, like our physician counterparts in other specialties that also have lobbyists. So I see that as a wonderful opportunity for us to collaborate with our other healthcare providers and understand what their concerns are, what their strengths are, understand what they appreciate about us, and vice versa. And then that helps us in our quest to provide the best care for our patients. That we recognize we have many things that are in common and that we are not competing against each other, but we are working together with each other, right? So what is your responsibility as the APRN? What should you do? What should be a passion for you? One, as I mentioned earlier, becoming a member of your professional organization. Two is advocating for nursing and healthcare reform. And we can do that by contacting our representatives and senators and telling our story. Nothing speaks louder than a personal story. So if you have a reluctancy or a fear of speaking to your representative, just tell your story. Tell them how whatever you are speaking to has impacted you or impacted your patient or impacted a family member, but just tell a story. And that oftentimes opens up the gateway for more conversations and they hear you. If they understand why it's important to you, then they're amped to listen to what is it that they could possibly do to assist and help. I also say we should leverage our relationship that we have as registered nurses, as advanced practice clinicians, as being a profession that has been well respected for many years and the most trusted profession. We need to utilize that as a platform to understand that it may open the door for us to have a conversation. How many individuals, I think everyone has someone in their family that's a nurse. You can leverage that as you're trying to speak with your representatives, your legislators. So now let's talk about what exists in the hierarchy, or shall I say, in the framework of the congressional staff. So you will see that there is a chief of staff, right, or their administrative assistant. This is the individual who oversees the management of the office. They manage the media, the public relations, the public advisors. These are very important people in the process if you would like to have your voice heard. Oftentimes, the chief of staff can be the individual who can bring your concern, your issue, your desire, your voice to your legislator or your representative. So if you have an opportunity to reach out to the chief of staff and speak with them, then you should do so. Never overlook them. They are often the ones that are having a voice and speaking to the legislator. They are often the ones too doing the research on the information that you present to them. You also have your legislative directors. They are the ones responsible to the day-to-day legislative activities. And then we have legislative assistants. These are often our post-college interns and fellows. They do have a lot of contact with special interest groups. They can often advise the members of Congress on health policies and control information presented to the member of Congress. So as you can see, the chief of staff, if you cannot get to that chief of staff, the legislative assistant is paramount to having your voice heard. So take the time and speak to the legislative assistant, have conversations, have your, what we like to call, elevator speech ready. A clear voice of what it is that you are speaking to. I always say, when you say elevator speech, think if you had to go up about 3 to 4 floors. You could tell the person in the elevator with you whatever your concern, whatever your thoughts are on any topic in the elevator ride to where they get to their floor. That's how quickly you want to be able to give that information. They may ask you for more information later, but you want to be able to go from A to Z in that short period of time. Pick out the important points, because oftentimes people don't have a lot of time. So they want to be able to hear you quickly and succinctly. So let's talk about political action committees. What are those? Our political action committees are groups formed to raise and contribute money to a campaign of political candidates. They separate certain funds, and they're not connected directly to any committee, right? So non-connected committees. We have organizations or committees such as the Citizens United, and it was the first amendment that allowed for financial political expenditures through a corporation's general treasury. They were the creation of the super PACs, and PACs must continue to be transparent, right? They are also our physician groups, our pharmaceutical companies, and these are the ones that have the most spending when it comes down to like the lobbying and being out there and speaking and doing and getting the ear of our representatives. And I want you to kind of just sit in that for a minute. Physician groups, pharmaceutical companies, they are the top spending individuals for PAC, the political action committees. So how do you think that impacts healthcare? You can stop this video for a minute and just think about that. Then we also have coalitions, right? These are groups where they combine resources to achieve a common goal, short and long term. Coalitions need a strong leadership, membership, and serendipity. So think about organizations that may want to come together. I think about if you have, we all know that there are advanced practice clinicians, but we have different organizations within those specialties. So you may have a certified nurse anesthetist organization. You may have a nurse practitioner organization. You may have an adult primary care physician or advanced practitioner. So they have these different organizations, and then what you want to do is have that leadership from the different organizations to come together. Or it could even be where you have the different academies for different specialties, HIV, cardiology, American Diabetes Association. You have ACOG, which is for the gynecological conditions in women's health. Bringing those together, and then they have make a strong coalition and move forward with a common goal. So it's not everybody going for their own, but we have a common goal. You can have some threats with that, because what can happen is individuals may need or desire different things. So you want to try to ensure that what you're going to be developing a coalition for is united. And an example of that is, although we're all different type of healthcare providers, maybe our coalition, our focus is going to be on reimbursement, or maybe our focus is going to be on improving patient outcomes in the hospital stay. So it's not about us individually, it is about a unified area of interest. There does become challenges with this, and that's having different perspectives depending on those organizations. But those are things that you need to work out to have a strong coalition. If not, it can oftentimes cause more damage and harm than good. Let's talk about healthcare reform. There are many areas that is needed for healthcare reform. I think this list increases every year. This is not a stagnant thing, but it is a ever-changing, transitioning thing. Healthcare reform, things like, what is the agenda of nursing? We've gone and we've seen that over the years, the nursing shortage. Now we're looking at nursing not being classified as a profession. We've done things like the safety of nursing, right? Not only as you all presented about the safety with what occurs in a hospital for all healthcare teams in surgery, but let's think about the safety as far as physical abuse of nursing. the, let's say, the patient-nurse ratio. These are all things that need reform. We have the Health Security Act, Patient Protection and Affordable Care Act, right? We also think about how the Affordable Care Act is being or trying to be reformed, and it has even before, and it was not successful. But where are we on that? And how is the reforming of how individuals get health care insurance or how the healthcare insurance reimburse, how does that impact healthcare, right? How does it impact not only the provider, but more importantly, the patient? And then the system. What is the impact when individuals lose their health care? So, what has been some long-standing policies and goals um, as it relates to policy? Let's talk about the nursing workforce development. We talked about that. I think it historically was projecting that 31%, we would need a 31% increase in advanced practice nurses between 2016 and 2026. We do know that advanced practice registered nurses is growing, probably one of the fastest growing disciplines in healthcare. However, how will this be impacted, or will it be impacted if nursing is no longer classified as a profession and individuals can't get the funding to be able to go to school? What is that going to look like? What will it look like if the reimbursement for APRNs is not at a comparable or equivalent reimbursement as our physician or other counterparts? So we then have advanced practice clinicians who have to see more patients um, to demonstrate their worth and to validate their importance in healthcare, right? In different institutions. If that happens, what is that going to mean for individuals wanting to come in the field because they have to work harder? Let's also talk about the State Nurse Practice Act, the scope of practice. Scope of practice differs from city to city. How is that impacting someone's ability to get a job? If you choose that you want to move and then you got to wait the extended time to get your license and go through the different requirements from state to state. Or with telemedicine, if you choose that you want to be a telemedicine provider and you have to get a state license in each one of those states because there is no compact license for a nurse, advanced practice registered nurse, right? So those are some of the long-standing goals that we need to face when it comes down to APRNs and policy. Ethics, we need to make sure that we are very aware of ethics, that we are practicing ethically, and that we are not looking out for just ourselves, but our patients. And the research. The research guides everything that we do. It's very important that we make sure that we utilize research, the data, to give the information in the background of why we are asking or why we are trying to get a policy, a procedure, or anything. We need to help our legislative, our congressmen understand from a research perspective, along with others, right? And then we need to look at what is the agenda of the individuals we're speaking to. Before you go and speak to someone, go to their web page, see what historically has been a part of their political agenda, and what have they invested in? What are their views? And then if when you go speak to them, you need to be able to speak to the pros and cons of anything that you're speaking on. No one issue is ever all positive, but be ready to speak to that may be opposite of what your perspective is. And you do that when you have evidence-based approach to how you're going to deliver the information to all individuals within the legislative body. And then you do not want to be speaking over their head. You want to make sure it is clear, it's succinct, and it is if a sixth grader would understand it, but you do speak from the evidence, right? So let's talk about education, practice, and policymaking. How do we apply and helping them understand that we apply a nursing process to what we do? And when I think about Maynard, I think about the four-dimensional intersecting model of teaching healthcare policy information. Commitment, initiative, involvement, right? So you need to make sure you're speaking to that. Nurse educators serve as mentors. Nurse executives with doctoral education can influence patient care policies. So, although many may not want to, or some may not want to embrace um, administration, policy making, it's important that those who have a passion or a clear understanding of policy and its importance, that we do sit at the table. And it starts at the institution in which you're working, and then you can branch out. It starts with allowing your voice to be heard and understanding. You can even just call your representative. You can call your legislator. You can call someone maybe in your institution that you know has conversations or sit at those tables so that you're now giving them the information so as they're sitting at the table, they can disseminate that information. But thinking creatively about how do we get our voices heard. And so when we think about the phases of policy involvement, I want you to think of this: survival, success, and significance. Survival, taking part in the voting process, serving on a committee or board. Success, choosing to become an influential policy arena. It's a choice. And then significance, intensely involving oneself in all aspects of the healthcare policy. We need to recognize that one, it is a core necessity that we partake in policy making. It is, you have to be passionate about it. And then as you involve yourself in it, it's going to give better outcomes. These are my references that was used to help create the information that was discussed in these lectures. So if you choose, you can read these articles and reference these online publications along with your textbook to further enhance your knowledge related to health policy and advocacy for the advanced practice clinician.